Hi, thank you for joining me here. Today is June 1st, and I'm sure you have seen it everywhere, all over Facebook, about MG awareness. June is MG Awareness Month. What is MG? Well, let me tell you, MG is short for Myasthenia gravis. Myasthenia gravis is also an autoimmune neuromuscular disease. There are a few different types, and some children can be born with it. It's in the genes, and then some people like myself develop them later on in life as an autoimmune disease. So I have been encouraging people to record their story and their journey in their words about myasthenia gravis, because every year we're trying to create a larger audience for MG awareness, because we want people to have heard of our disease, which is where the hashtag came from, the hashtag I have heard of MG. I was diagnosed with myasthenia gravis just over 4 years ago. Not a long time. People have had myasthenia gravis for 20, 30 years. So my relationship with MG is very short compared to a lot of patients. However, it does not seem to matter how long you have had myasthenia gravis for in order for it to truly impact your life and change it forever. And sadly, people my age and younger, even a 6-year-old child, has died as a result of myasthenia gravis. So why all the fuss? Well, there's not that many of us, and we understand that. The number in the population of people who get MG is relatively small in comparison to people who, say, get cancer. But cancer gets a lot of awareness and funding, and so there are treatments and awareness, and everybody knows about cancer. Whereas with myasthenia gravis, although it does not require the same degree of acknowledgement, I understand that, but it gets so little acknowledgement and awareness that doctors and healthcare staff are not fully trained on myasthenia gravis. They don't know what it is, they've never heard of it, and they don't know how to treat it, nor do they know how to diagnose it. The same was with me when I first got my hospitalization with my vocal changes, blurry vision. I couldn't walk, I couldn't use my arms. And they ran some tests, and they said that they couldn't find anything wrong with me and that it had to be in my head, and recommended a psych evaluation. It was at that time that I went to USF here in Tampa to a neurological team experts in neuromuscular diseases. And as soon as the doctor saw me and examined me and looked at my records, she's like, I know exactly what you have, and it's called myasthenia gravis. That was the very first time I had ever heard of myasthenia gravis. So anyway, without making this too lengthy, because I can tell it's very difficult to make a short video on MG, but to say the least, it has been a whirlwind of a journey, and like I said, I've only had MG for 4 years. Now, the last 2 days, I've had IVIG. So today is one of my better days. Tomorrow should be a little bit more better. But by the end of the week, I will be probably bedridden again and unable to stand up and walk for long or talk. And those are some of the symptoms of MG that just don't ever go away. These treatments are so demanding on our bodies and on our lives. They affect our family. We can't travel, can't go too far. We are bound by our medications, our treatments, our doctors, and so our lives are forever changed. And it's not just me. I feel blessed in many ways. I am 47 years old, so I was 43 when I was diagnosed. So for me, I got to work all my life, worked full time. I raised my children. I was healthy my whole life and active, and all of that came to an abrupt stop when Myasthenia Gravis entered my life. So for me and for others out there that share this disease, we just want it to be heard of. Like I said, for doctors and healthcare workers to understand it, because patients with Myasthenia Gravis can get into an MG crisis, which means they cannot breathe. The diaphragm muscles are not working, and without medical intervention, they will die. And most doctors in ER rooms around the country are not aware of MG or know how to recognize it in a patient. So we need the awareness in order to educate the medical profession. We want to educate the public because their lives might be afflicted by this at some point too, because it can happen to anyone. And also for funding and research. Without funding and research, we will never find a cure for this disease and or better treatments. Nothing has been improved for the treatment of Myasthenia gravis in 50 years. So there has to be change because more of us are finally getting diagnosed, and the doctors only have a handful of options in treating us. This disease is lifelong. Now, everybody reacts differently to the disease. They respond different to it, and they respond differently to treatments, which is why we are referred to the snowflake disease, because each and every one of us are unique. So, without your help and your support, we cannot get attention to our disease in order to create the funding required for research that we badly need. And so by liking this, sharing it, doing your own story, whatever you can do to help us get awareness for Myasthenia gravis, to improve the quality of my life and many, many others. Thank you.